Well, let's fill some time and talk about my having 2 spinal fusion surgeries in 3 days and the aftermath. This part that leads up to those surgeries involves the war on opioids. It has become the war on pain patients. It involves a primary care physician who just went off the rails after 20 years of treating me. That caused me to write a $7,000 check. And then that caused me to be a medical pariah. There was a rock star neurosurgeon who, it seems like because of her dislike of opioids, affected her judgment. I ended up having 2 years of extreme pain. And then there are 2 doctors who saved the day. And I can't wait to tell you about them. I need to tell you how all this got started. But first, let me tell you about this picture. In early 2022, we finally got a Costco in our community, and my wife really wanted to be a member. They built that Costco out by an area in our community, which has become a medical center, and I had a doctor's appointment out there one day. Now, I had taught myself how to drive despite the terrible pain that I had when I was sitting or walking or standing. Let me describe this pain real quickly. It started, if I was walking or standing, it started in the hip and would go down the leg, and it felt like 1,000 razor blades rolling down or ice picks stabbing in there or flaming spears. It was very sharp, intense, incredible, like above 10 kind of pain if I stood for any length of time. And then when I sat across the buttocks above the cleft, there would be the same pain going across the side. And the only way that pain was relieved was if I lied down. And I spent a couple of years lying down, and I'm going to tell you about that in these videos. So I'm out at a doctor's appointment, the Costco's there, and I thought, well, let me check it out and see if I can go in and get our membership going. So I drive over there, and there's not very many cars in the parking lot. At least it's about half full, so I thought maybe I can do it. So I go to the handicap parking lot and don't pull out my walker. I just take my cane and I walk in, and the counter for customer service is empty. There's a lady sitting there and she's working on a computer looking real intense. And I went up and stood there for a minute and I waited a little bit, and finally I said, I need to get a membership going. Can you help me? And she said, yes, sir, I can help you. I'm just having a little problem here. Hold on. So I'm standing there, and the longer I stand there, the harder this is getting. I mean, the pain is always intense when I'm walking or standing or sitting. And the longer I do it, the worse it gets. So I'm standing there, and finally I said, ma'am, I've got a back problem. I need to lie down for a minute while I'm waiting. She said, okay. Didn't hardly pay attention to me. And at the side of this long customer service counter, I could lie down there, and there was a rolling bulletin board kind of there, so it hid me from the other people at the Costco, because I got to tell you, people get disturbed when they see you lying down. And this is exemplified by what happened next. I'm lying there, and all of a sudden I hear this noise, and I look up, and there's this woman from further down the counter coming at me saying, oh, are you okay? Are you okay? And I said, yes, I'm fine. I'm just taking a pain break. I just have a back problem, and I'm waiting for her. And oh no. And she turns around and says, call 911, call 911. Well, I got off on my cane and stood up, and I said, I'm fine. Just, it's okay. Don't call 911. So I go and I stand in front of the counter, and she's still working there. And I'm just, okay, it's fixed. And she takes my information with, that part doesn't take long. And she says, we need to get your picture. And I go over there, and that's the picture I took. I mean, if anything exemplifies the kind of pain I was in, there it is, red face. I tried to smile a little bit through the agony that I was in. But that's the way I lived my life for 2 years. I started having back pain when I was in my 40s. It was the 1990s, but it was different than what I ended up having. The pain was a sharp, rolling kind of pain like I just talked about, razor blades and ice picks. But the first pain I had actually happened in my back and not down my leg like stenosis typically does, although I'm told it's all related. But in my 40s, I began to have pain at rest when I was sitting or lying down. It was a kind of a grinding ache, a twisting, grinding ache in the lower back whenever I sat for any length of time or when I lied down and tried to go to sleep. I could handle it during the day by movement. If I moved, it got better. During that time, I was doing a lot of writing, so I would go over to this coffee shop nearby, Jittery Joe's, and here it is. And you can see there's a high counter there with these high chairs. And I would sit on those chairs and work on the keyboard, and then when it started hurting, I would stand up and work on the keyboard and kind of move back and forth, and then I'd sit down again. I'd do that sometimes all day. If I went to a movie, halfway through, I'd start having that pain in the lower back again, so I'd get up and go to the back of the auditorium and stand there for a little bit and move. I could handle it during the day, but I couldn't get up and move and sleep at the same time. I'm not a horse. I can't sleep standing up. And so I had to figure out something to do so I could sleep because it would just keep me awake. It helped if I arched my back, so I'd lie on my stomach and put my hands in my chin in my hands and arch my back like that with my elbows resting on the bed. And a lot of times I'd fall asleep that way. But I couldn't sleep too well like that either. So I started using ibuprofen. I tried one tablet and it worked a little bit, and I read the box and said you could take 2. Those tablets over the counter are 200 milligrams, so when I took 2, I was taking 400 milligrams of ibuprofen. And then I would wake up during the night and that ache would have returned, so I'd take 2 more over-the-counter tablets of ibuprofen. So I was taking 800 milligrams a night. And I started doing that around the year 2000, right at the end of my 40s. So by 2010, I had been doing it for more than a decade. And that's when I saw this television show. It was a medical show that was on Fox News on Sunday morning. Now, I don't like any cable news network that have agendas, and I really don't like Fox News. But this was not a show with an agenda. It was a long time ago. It had no politics in it, and none that I could detect. The host was Dr. Isidore Rosenfield, and I looked him up. He was a well-known doctor, and he would just report on how to take care of things, and he did a lot of reporting on research. One Sunday morning in 2010, he talked about research that had been done in Denmark that tied ibuprofen to a risk of heart attacks. Now, what the studies found is that risk is elevated from the very first dose you take. But the risk gets higher and higher if you have 4 things going, or 2 or 3 or 4 things going on. One was the higher the dose, the more the risk. And I was taking 800 milligrams of ibuprofen every night. That's insane, I found out. And then the longer you do it, the greater the risk. By then, I'd been doing it for more than a decade, like I said. And the older you are, the higher the risk. Well, I was 60 years old in 2010, so I was into the old guy territory. And if you had a comorbidity like heart disease, that elevated the risk. In the early 2000s, I found out I had a 65% blockage in my LAD. That's an artery in the heart that they nicknamed the Widowmaker. That's not good. So I checked all the boxes. I found out that ibuprofen is a dangerous drug. We hear all this about opioids, but ibuprofen has some issues. One is its heart attack risk, and when I went to the Internet School of Medicine after seeing Dr. Rosenfield's report, because I'm not going to just take one guy's word for it, I looked up that Denmark study and I read it. And then I read some other stuff, and I found out not only is there a heart attack risk, there's a real risk of gastrointestinal bleeding, and that's another one. The older you are, the worse that is. And there's a lot of doctors that just won't prescribe ibuprofen to their senior citizen patients because it's dangerous. A common reason for people to go to the emergency room is because people are bleeding from taking NSAIDs like ibuprofen. So I was really disturbed about that. Now, at the end of his report on the Denmark research, Dr. Rosenfield suggested some alternative medications, and he talked about opioids as being one of those. Now, this was before the war on opioids, and before the war on opioids had become the war on pain patients. So I went to talk to my primary care physician about all this. Okay, I need to break in and add something else. There are lots of people out there who insist that there are ways that we can deal with pain other than opioids. And they're right. There are ways we can do it. Now, long-term, NSAIDs, they're not the answer. They're dangerous drugs, like I just said. There's other drugs that we can try. Tylenol, for example, now, or acetaminophen. I never can say that, so Tylenol will have to do. Tylenol's never done jack diddly for me for anything, but I still keep trying it. I mean, I'll still try it now on dealing with the issues that I'm still dealing with. But really, I've never noticed a bit of difference. Now, the other thing, other than alternate drugs that people talk about, one of them is physical therapy. And as you'll hear in this deal, I've done a million rounds of physical therapy, and it's really helpful. It helps me in a lot of ways, but it does not deal with the nerve pain. And I had a physical therapist of 35 years, as you'll hear later on, finally tell me, I can help you with a lot of stuff, but I can't help with your nerve pain. Physical therapy is not the solution for the kind of pain I had. Now, the third thing that people talk about all the time is mindfulness, when you use your mind to overcome the pain in your body. And I'm a fan of mindfulness. In fact, I literally have a master's degree in mindfulness. My master's degree is in the humanistic psychology program at West Georgia College. And in that program, we had to commit to our own personal growth, and we were trained in hypnosis, meditation, guided imagery, all the stuff, everything that's included in mindfulness. And while my doctoral program didn't have that focus, all that stuff was reinforced in my doctoral program. So trust me, I'm a really well-trained person to do mindfulness as a way, or to try mindfulness as a way to deal with my pain. And I did. I used YouTube videos with guided imagery. I did some of that to try to overcome when the pain just wouldn't quit. But there is no way that mindfulness was any kind of a solution long-term for the kind of mind-bending pain I had. And if there's anybody out there who continues to insist that it is, you just haven't had the kind of pain I've had, honey. You just haven't had it. And really, just shut up, okay? Again, all this stuff is useful and certainly ought to be tried before you use an opioid. But as long as you don't become disordered, opioids are really safer than a lot of other things that you might take. So, with that said, let's get back to my primary care physician and opioids. My primary care physician at that time began treating me in January of 2003, and I'm going to talk a lot more about all that later and all those years that he treated me. But when I went to talk to him in 2010 about this concern about NSAIDs and ibuprofen, he agreed that 800 milligrams of ibuprofen every night forever was a bad idea. So he prescribed 10 milligrams of hydrocodone and 5 milligrams of oxycodone for me to take in the evening so that I could sleep. I don't know why he picked that combination, but it worked. I would take it about an hour before I went to bed, and then I would go to bed and sleep without waking up in pain. And it was great. I had no issues with it except constipation, and with that low a dose, I learned how to deal with it. I took Activa yogurt. I had read that would help with it, and I bought that, and it did. He also ordered some x-rays and referred me to an orthopedist. And the orthopedist looked at the x-rays, and he said, "You have arthritis." Now, later, the arthritis was actually stenosis in my back, is what they call it, but he didn't mention stenosis. He gave me a pamphlet with some exercise in it I could do and referred me to my first of many rounds of physical therapy. And so for the next decade, or thereabouts, that worked. And then something happened that changed things big time. Before I get to that big thing that changed, I need to tell you that 2002 was a very big year for me. In August of 2002, I had my last drink of alcohol, and in October of 2002, I had my last cigarette. That means, yes, I am a recovering alcoholic. Now, I know that there's a whole lot of recovering alcoholics who might be watching this going, he's a recovering alcoholic, and he's taking opioids. And I am. And what you'll find is I have taken them for many years. I'm not cross-addicted. Everybody isn't. Now, my experience with the recovering alcoholics I know, and I know a lot of them, yeah, most of them had a pill problem as well as an alcohol problem, but I never had that. Look, I went to college, and maybe that means I grew up, in the late 60s and early 70s. And that was prime time drug time. I mean, the Stagma Coliseum at the University of Georgia, and they had concerts there. all you had to do was breathe and you get high. And there was all kinds of other stuff, psilocybin, I think, what is that, mushrooms. I don't know much about drugs because I never got involved with them. I did smoke marijuana a few times, and I did inhale, but I didn't like it. The first time I smoked marijuana was on a snow day. We didn't have school. Even the University of Georgia canceled classes, and that was pretty rare. And I was renting a house with a friend of mine, and he came in one day carrying this big garbage bag, and it turned out it was full of marijuana. He decided he was going to make a little money on the side. And I said, wait, we can't. I was about to begin my quarter of student teaching. And I said, look, I'll lose my career. The lease was in my name, so even if I wasn't the one doing the selling, I would be having a disorderly house for drugs, and that wouldn't be good for my career. So he agreed to take them away, but it was a snow day, and we really couldn't do anything then. So he asked me if I wanted to try it. So I did. Man, I remember lying in the kitchen of that house with a whole loaf of bread sitting there and just eating one piece of bread after the other and not wanting to, but I was so hungry I couldn't stop myself from doing it. I hated that. And then I'd start laughing and I couldn't quit laughing. I hated that. There was nothing good about that experience for me. Now, I've gone up and down on opioids for all these years, and I've never had a craving when I came down off of them. I went, and I'll talk about this later, but I went from 180 milligrams of morphine a day, which is huge, down to 30 milligrams of morphine a day in 6 weeks, once I found a doctor who would do what he was supposed to do and help me taper. And I never had one craving during that time. I never had a craving after my last drink of alcohol. I did, though. I know what they are because cigarettes were a different story. Nicotine, man, that tore me up. I'd be sitting in the car and come up to a stop sign with the car in front of me, and I'd see that arm go out with a cigarette in it, and it would just rush all over me for a long time. So after I quit drinking in 2002, and once early 2003 came, and I got over the mental anguish that happens, you got to get your brain fixed again because it's when you remove alcohol from it after it's been there for a long time, the synapses are messed up, and it takes a while to get back to being right. So I was doing pretty good, though, by early January, and that's when I decided to get a primary care physician, and I'll talk about that process in a minute. But I began working hard on my physical health. Over the next year, I developed a eating pattern that caused me to lose 70 pounds. I bought a treadmill, and I started walking on that treadmill and then running on the treadmill, and then after a while, I started going out on the street. So by the spring of 2015, I was running 5 miles a day, every day. I mean, rain or shine, no matter how cold it was, I didn't miss a day. The only thing that slowed me up was if there was a thunderstorm, and I would wait that out. So one day in the spring of 2015, I'm running along, just enjoying the day, sort of. No, let me stop for a minute and tell you this. One time I had somebody tell me, this is just an Uncle Eddie story aside. I had somebody say, I would love to run like you do, but I just don't enjoy running. And I laughed and I said, enjoy it. I tell you when I enjoy running is when I'm on my bench in the front yard and I'm sweating. And sweat is just pouring off my face, puddling below me. And my heart's beating like this. And I'm done. I'm finished with the run. That's what feels great. There is nothing better in the world than that. But running up a hill, no, I don't enjoy that particularly. So I was running along, and then all of a sudden this pain hit me, boom, right here, and I stopped. I said, what was that? But after I stood there for a little bit, it went away. I said, okay, I guess it was some kind of hitch or something. So I started running again. I remember I was over in Beechwood Hills, they call it. I was running again, and all of a sudden, wham, hit me again. And I stopped again. And then within just a short period of time, it was very hard for me to walk because every time I walked, as I mentioned earlier, this ice pick and razor blade stuff, it was sharp as could be. And every now and then it'd be a flaming spear poking in there. It wasn't as bad as it got later, but experience is all, and that was the first time I experienced this kind of pain. It really hurt. So I got home and I studied. I do what I always do. I went to Dr. Google and studied some. First, I was afraid that my hip had gone bad. I had a sister who had had a hip replaced, and I thought, genetics, now it's my turn. But what I found out at Dr. Google was if you have a hip joint problem, the pain is generally in the groin, not on the outside out here. So the next thing I found out was a piriformis syndrome. There's a muscle right here called the piriformis, and you have nerves that come out of the spine and goes through the piriformis muscle and then down the leg. And that's what we call the sciatica nerve, but there's really a bunch of them. And when the piriformis is strained, it contracts and it squeezes those nerves, and that causes that pain that I had, I figured. And the way you dealt with a piriformis syndrome, or one of the ways, is to do stretches. And this one, the figure 4 stretch, was the biggest recommendation for that. So I started running again, and the next day, and when it hit me, I laid down and did the figure 4 stretch, and that seemed to help, and I'd go again and do it again. Now, what I think now is, it doesn't hurt to do the stretch, but what really was making it better was just stopping. And I would let those nerves rest a little bit, and then they'd be okay until they got squeezed again. So I realized pretty soon I needed to find a doctor. And it's time now for an Uncle Eddie life skill detour. How to find a doctor. There was a time when I thought all doctors were smart. I just assumed they were. I'd always heard medical school was pretty hard, so if somebody graduated from it, they must be smart, and they must have good judgment. Well, you know what? That's not true. I should have learned with a pilonidal cyst that I had at age 21. Pilonidal cyst is this cyst at the base of your spine. It has nothing to do with anything else I'm talking about today, stenosis and all that. This is just a space that's there congenitally. You're born with it, and it fills up with junk, all kinds of hair and stuff, and it can form a cyst, and then that can become infected, and that's what happened to me. And so my dad had a doctor who he went to for his every 6-month airline pilot physical he had to have. And that guy was also a surgeon on the side. So I went to him, and he did the operation. It was during Christmas break during my first teaching year. And I was in the hospital for a week. And when I came out of the hospital, it still hurt. It was hard to move. And he had there was a wire, there was an incision on the back, and there was this little wire, silver wire that went through the skin. And then there was a button sewed on the top of the incision on my body. And that wire was wrapped around that button. And that really made it hurt. And so after a week in the hospital, it was another 2 or 3 weeks before I went over there and they took that button off of me and took out that wire, and I was okay. Well, it turned out a year later when I was teaching in Athens, and at some point you need to check back and look for videos about all that teaching stuff too. I was about a month into the school year when this same place started hurting again. Now, there was a doctor in town in Athens who I had seen where I lived when I went to high school in Noonan, Georgia. And he had come here to be just a general surgeon. So I went to him, and he looked at what had happened. He said that doctor who had worked on me before, the airline pilot physical doctor, had done a surgery that hadn't been done since like the 1800s. And because he didn't fill in the cyst, he just sewed it up and put that wire in it, that meant it's just going to form again. So I did a surgery with him. I was in the hospital with him one night. And when I left the hospital, I had no pain, and that pilonidal cyst has never come back. So I should have learned then, you better check out your doctors and do some research. Now, we didn't have the internet then, so I don't know how I would have done it. But I finally learned my lesson for good, well, sort of, when I got my first primary care physician and what happened with him. I didn't have a primary care physician until I was 50 years old. Before that, I was pretty healthy, and we didn't have urgent care centers there, but we had these medical practices that didn't require appointments. I think we had about 3 of them in town. So if I ever felt sick or had some need to see somebody, I would just call around and see who had an empty waiting room, and I'd go to that guy. Again, I figured they were all smart and all had good judgment. So when I decided I needed to have a primary care physician who followed my health, because I was having some illness problems that actually turned out to be alcohol related, I went to a doctor who I had gone to 20 years before, and I liked him. and he was still in practice there, so I went to him. And I had a list of things that I wanted to get done, and one was a colonoscopy. I was 51 then, and you were told then to have a colonoscopy when you're 50. And he said, "Hey, I do colonoscopies." And I said, "Great, I don't have to go see anybody else." So we set up a time, and he told me how to do that. I got an awful prep, where you drink a gallon of stuff and then you squirt for hours, and it's just awful, and you're hungry and sick. And so I did all that, and I went into his office for the colonoscopy. It turns out he had a colonoscopy machine like up in his attic. So I go up there, and I found out later that when you have a colonoscopy, generally you get knocked out. Now, he didn't have an anesthesiology support, so instead he just gave me a shot of something to make me relax, he called it. It's probably Versed, but it made me a little loopy, but I was aware of stuff. I lie down on this table, and he's got this machine there, and I see this hose, and I know where that hose is going, and that's like, ooh. And after he lets me time pass so I get real loopy, he starts inserting that hose into me. Well, pretty soon I felt this pain right here, and I looked down, and I could see him working down there, and he was kind of grimacing, and then I felt this pain again, and then I look down, and he's like going like that. I mean, pretty hard, and then I can feel it, bam, 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 and this ouch. And I said, that hurts. And what happened was, turned out the colon makes a turn right there, and he couldn't get that hose to go around the curve. So he said, well, I guess we're not going to be able to do that here. And he didn't want me to go through all that prep again, so he called over to a local hospital where there was a real gastroenterologist there doing colonoscopies that day, and that guy said that he would take me. So I remember walking down the stairs from that colonoscopy attic, and she was having to help me because I was just whacked out. I don't know how I survived the trip over the hospital, but then they knocked me out, and they did a colonoscopy. They found polyps, so I was going to have to do it again in 3 years and all that. And so I did some Dr. Google studying on colonoscopies better than I had done before, and it found out that a colonoscopy is only as good as the endoscopist, or the doctor who's doing the colonoscopy, is at detecting polyps. Polyps are sometimes hard to see. Especially on the right side, they can be real flat, and you need a guy who's going to take his time and really look hard and be skilled at it. And a primary care physician who took weekends training from the colonoscopy machine company so he can increase his income stream in his practice is not the guy you want to go see. I did some studying to find out the next guy who was going to do mine, and found a guy who graduated from Vanderbilt's medical school, which is, Vanderbilt's a smart school, so that was good. And he was the chief resident in endoscopy, and he had won all these endoscopy awards, and apparently he was a very good endoscopist, so he's the guy I chose, and he's still doing my colonoscopies, Dr. Bradley Shepard. So by the time I had this pain, I wasn't going to go to just any orthopedist, except that I still hadn't learned enough to really study individual orthopedists. We have a practice in town, and everybody I know went to that practice, so I figured if a doctor was in that practice, they must be pretty good. So I made an appointment. I called, and the woman who answered me and made the appointment, she asked me what was wrong, and I told her. So then I went to the appointment. I was sitting in a little room when the physician's assistant, or PA, came in. And she sat down and said, okay, I'm going to schedule you for an injection. And I said, a what? An injection? She said, yes, it's a diagnostic injection. And I said, well, don't you want to hear something about what's wrong with me? She said, oh, no, I know. Well, look, for all she knew, whoever that second person was who took my information might have mixed my slip up with somebody else, and I was there for my Dupuytren's contracture. And an injection into my spine is not going to help a Dupuytren's contracture. I just wanted to be sure that she knew what was wrong with me. So I said, again, I really would like to tell you. So she leaned back and literally rolled her eyes and said, okay, go ahead. So I told her, and she said, okay, we're going to schedule you for an injection. Well, I just wasn't happy about that. I wanted to have some imaging done just so we know exactly what's going on. Let me give you an example. Just in the last month, I've known somebody who had sciatica-type pain down their leg, just like I was having. And he had gone to a local orthopedist, just somebody who had worked with other people in his family or something, and that guy said he was going to put a spacer in the spine. And I said, why don't you go see this doctor who worked with me? And I'm going to tell you about him later. And so he went to that doctor who really did some studying and found out he had a cyst on his spine. That was his problem. And so he had that cyst removed. He got a lot better. Having a spacer wasn't going to help him. So you really want to study up on the doctors to be sure that you're getting the right guy. So I asked around. I started asking people I knew in the medical field and friends and social media and that sort of stuff. And the name I heard over and over and over again was a neurosurgeon in town. I mean, she was a rock star neurosurgeon. We had a neighbor who was a surgery nurse. All she did was work in the operating room and help with surgery. And so she had worked with all the surgeons in town. And first person she said, this is who I'd have work on my back, and she named this neurosurgeon. So I said, well, thank you. That confirms it. And I turned to leave, but she stopped me and she said, wait, I want to tell you something. You should never, ever, ever, ever let, and she named a surgeon, touch your back. And then she told me some horror stories that she had experienced from knowing his surgery history from working with him in the operating room. Well, guess, have you got it? It turned out to be the surgeon with the rolling eyes nurse. So my instinct wasn't wrong. So I found this rock star neurosurgeon, and she ordered an MRI first thing, and she studied up on it and said she wanted to do a laminectomy. Now, your spine has this thing called a lamina on it, and I don't know all the details on this. You can look it up. But a laminectomy is when they come and they take out some of that lamina so that it keeps the spine or helps the spine not be pressing on the nerves. Basically, it is that your spine is degenerating and it's growing bone spurs that press on nerves. It's crumbling, it presses on nerves. The disc space squeezes and nerves coming out of that space get squeezed, and all that pressing on nerves causes pain. So the idea of the surgery is to relieve the pain by decompressing the nerves. So one way she was going to do this was to take the lamina out and not press the nerves with that. So that's what we did in September of 2015. Now, that was supposed to be an outpatient surgery, like almost all surgeries now. But I learned another lesson. Here's another life skill. When I woke up from the surgery, I felt really good. The pain was gone when I moved, and I learned a lesson there. You don't really wait and judge that for a while because they put local anesthesia where they do the operation, so that until that wears off, you don't really know where you stand on anything much. But I was pretty much pain-free, and I was just in the recovery room waiting for them to let me go home when I got hit. The pain started again, and this is a different pain. This was a very deep, profound pain at the base of my spine. I mean, it wasn't like that grinding pain that felt kind of like muscle pain before. This was just a deep, 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 awful pain. And so the recovery nurse tried to find somebody to help me. And here's the life skill. Don't ever have surgery that starts at 1 o'clock on a Friday afternoon. By the time I got in the recovery room and all this stuff started happening, it was after 5 o'clock and everybody had gone home. She couldn't find anybody to come help me. Now, I was real loopy and I don't remember. My wife said the recovery nurse was just beside herself trying to do that, trying to help. She finally found an anesthesiologist. I say that 4 times. And he came in and gave me a shot of Dilaudid or hospital heroin, something I had several times later as my pain kept getting worse and worse. And I got a lot better, but when they got in touch with my neurosurgeon, she said she wanted me to stay in the hospital that night because of that pain and to be watched. So I went up to the room, and I woke up in the middle of the night, and I was feeling pretty good. Now, when you're in the hospital, they have these squeezy things on your legs to keep you from getting deep vein thrombosis or blood clots that can kill you. And they always say that it's good to get up and walk. And I had read all that, so I wanted to get up and walk. Plus, I'd been lying there for hours and hours, and by now the muscles were sort of, wanting to walk. So I was hooked to this IV pole, those poles they roll around and they hook you in there. So I got out of bed. I took those cuffs off my legs, and I got out of bed, and I went walking down the hall. Now, this hospital hall was... Everybody else had major orthopedic surgery, and most of them couldn't get out of bed. And so as I'm walking down the hall, this nurse comes at me, and I guess I freaked her out. She said, "What are you doing? What are you doing?" I said, "I'm just trying to get some exercise." So she made me go back into the room. But I went home, and the neurosurgeon prescribed gabapentin and then some more opioids, including Oxycontin. Now, the oxycodone that I had been taking and the hydrocodone was immediate release stuff. And the Oxycontin is something that slowly releases over time. And when I got home, I tried walking down the street pretty quick, and I remember that being very, very painful from the incision and from having your bones cut. I remember getting about 3 houses down, and those folks had a bench in front of their house, so I sat down on that and rested a little bit, and then I went back in. But pretty quick, I started getting better and better. And by the end of December, 1st of January, I was beginning to come off the medication. Now, gabapentin or Neurontin, which is a medicine for seizures, but it also helps with nerve pain. So you're often prescribed, almost always you're going to be prescribed gabapentin or pregabalin. And the thing you might not know about that is those two drugs are drugs that your body becomes dependent on, just like opioids. And if you just quit taking them, then you're going to have pretty good withdrawal symptoms. So just like with opioids, they began tapering me off the gabapentin. And so I want to take a minute to talk about withdrawal. The business of how to withdraw from these drugs that you become dependent on is a big part of this story. So I want to talk about that for a minute. Again, both gabapentin and opioids are medications that your body becomes dependent on. And if you quit taking it, you're going to feel bad. And it can be real bad if you stop taking it immediately. And as I said before, I've gone up and down on opioids and gabapentin and pregabalin many times during the last 20 years. And here's a contemporary post I had on Facebook, January 19, 2016. I'm going to read this for you. Somebody may be listening to this and can't see it. It's the second day of the third week of coming off Oxycontin and oxycodone. Just like with Neurontin, and that's gabapentin, before it, the bad part starts on the second day after a cutback and lasts for about 3.5 days. Now let me say here, what I was doing was started with the gabapentin first and came off of it, and then came off the oxycodone, and I cut what I was taking in half. Now, I wasn't taking real high doses of either one, so cutting it in half worked for me. But if you're taking higher doses on this, you may only want to cut it 10% at a time. But I would cut it in half and then go a week and then cut it in half again and go a week and cut it in half again. So I said the bad part starts on the second day after a cutback and lasts for about 3.5 days. After a couple of normal days, it's time for another cut, and then it starts over again. So you feel kind of bad when you first do it, then you have about 3 days of feeling pretty fluey and weak and fatigued and just yucky. And then you feel better. In the last 2 days of the week, I would feel normal. And then I would go through that again. Now, here's the most dangerous part. Until I'm done suffering in a couple of weeks, I've decided to give up my Sheldon-like refusal to never eat chocolate chip cookies. Chocolate chip cookies help me get through the withdrawal, and I highly recommend them. By February of 2016, I had come off of the gabapentin and Oxycontin that the neurosurgeon had prescribed. I was still taking oxycodone for my back issues at rest, although my primary care physician had done away with the hydrocodone, and now I was taking, I think, about 10 milligrams of oxycodone every night, just like I was before the stenosis kicked in. And I was pretty much pain-free by February 2016. I did try running one time, and I got to the mile point. I knew exactly where that was because I knew my routes, and I felt some pain down my leg. It wasn't bad, but I felt it, and I thought, okay, I can't do this because I didn't want to restart that really bad pain. So I walked home, and for the next year, I was pretty much pain-free. And then the pain returned with more opioids, way more opioids. And then you'll hear about how my primary care physician just went cracker dog. There's a link below. So, till next time, it's always good to see you.